Welcome to the Movement PT Coffee Cast, where we sit down and talk about physical therapy, health, and whatever else comes to mind during our coffee infused conversations. What's going on, guys? Welcome back to the Movement PT Coffee Cast. My name's Dalton, and with me, as always, is my beautifully bearded friend, William. William, how are we doing today?
Well, Dalton, it's a good day. You know why?
Why? Tell me why.
Well, we're here in person together.
I know. It's been a while. I haven't seen you, and it's been like a month, maybe longer.
Yeah, it's too long, you know?
Yeah, I know. I've missed – the beard looks way better in person. Way better.
Well, cheers, man. I'm excited to record this episode.
As am I. So, guys, we're back at it again with another episode. On this episode, we actually have a student from Queen's University. His name's Alex Derksen. He's going into second year. So, Alex, welcome to the show, man.
Thank you so much, guys. Yeah, it's definitely an honor. You guys are just crushing it in the PT world right now with all the resources you're putting out from Facebook, your student driving health group that you've created, your Instagram, and your podcast. So, yeah, I really appreciate the opportunity.
Thanks, man. Those are some kind words. We didn't prep them on that, guys. This is no prep at all. This is just straight up. So, Alex, why don't you just kind of start off and give our listeners just a little bit of background on yourself and how you got to Queens and what you got going on right now.
Sure, yeah. Like you said, I'm a second-year PT student at Queen's University, which is in Kingston, Ontario. I'm originally from Victoria, British Columbia, and I did my Bachelor of Science degree there in psychology, actually, at UVic. So kind of took an alternate route there. Played like many sports growing up, like baseball, hockey, golf, volleyball, and all that, and then kind of reached the end of my, let's say, sporting career and joined CrossFit, and have been doing that for 3.5+ years. I actually didn't get into PT school the first year applying, so I got waitlisted. So kind of faced some adversity from the beginning, and then got more experience both in like work and volunteer and kind of like a holistic approach to the physio world. So like ortho, neuro, senior community rehab programs, like working with kids with autism. So kind of wanted to build around that and kind of get the full experience of the physio world, and then got accepted to Queens and drove across the country, and the rest is history, I guess.
There you go, man. Yeah, that's interesting that you say, taking that year to kind of get more experience in many different realms. Was that something you kind of tried to do purposefully when you're in between years to kind of get a better understanding of maybe the profession from more than one aspect? Like, I'm sure you probably saw it from mostly an orthopedic mindset, given like your background.
Yeah, definitely. I think we all kind of think of physio in that ortho setting, but my whole goal is to kind of see what else is out there. And not only that, I think it kind of gives you better experience and just how to communicate with different populations and like just like build your experience up. And I think that's so valuable as just as a student, but also as a physio going into going into real life, I guess.
Did you say you took undergrad in psychology?
Yeah, I actually did. So the way that UVic works is you have to kind of apply to kinesiology like right out of first year. And first year I took kind of all the hardest courses I could take, which was maybe not the best idea, but I want to get them out of the way from the beginning. And so my GPA wasn't amazing after that first year. And you have to have like a pretty high GPA to get actually into kines. And I really didn't want to spend like 6-7 years in my undergrad, like apply after year 2, after year 3 into kinesiology. So I still got to take like physiologies and anatomies and a bunch of kines courses, but I want to kind of go the alternate route and go psychology, and found it really interesting. I actually can kind of apply some of what I've learned now, because what we learned from kind of pain science and all that kind of stuff, a lot of it is kind of psychological. So in the end, it kind of worked out, I guess.
Yeah, I was going to say, were you surprised when you kind of got immersed in the physio world, how much those psychological principles can help guide at least how we communicate with people?
Yeah, no, I was super surprised. Like at first, most people ask like, why would you go from psychology to like physiotherapy? Like, I don't understand how that works. But I think with the knowledge knowledge that we've starting to build up now, I think you can kind of see like a lot of it is based on that biopsychosocial model. And I think it's so valuable to be able to apply those principles with your patients. But yeah, I was definitely surprised going on. When you think of physio, you think of just physical type stuff. So it's been great being able to apply that knowledge. Yeah.
So you've
Survived.
finished your first year. Congrats from both of us.
Appreciate that. Yes.
So why don't you just give us a little brief overview of how it went for you? Was it what you expected? Was it way different than what you thought? Was it somewhere in the middle? Kind of give us the overview.
First off, really appreciate it because surviving first year was a tough experience. It is, yeah. It was crazy. I'm not gonna lie. Like, it was very fast paced. A lot of materials being thrown at you, and like not coming from the classic Kniest route. There's a lot of new materials, so it was a tough learning experience. But like I got through it, I guess. I feel like just the amount of sheer volume of work that's in the PT program, like right off the bat, it's a tough transition, even from undergrad. And they say like, oh, it's just 70% pass rate, but like it's not like an undergrad 70. Like undergrad 70 it's not too, like it's pretty easy, I guess. But from this point, like this perspective, I think like a 70% with this amount of work is actually a lot harder than you think. And I feel like I did have doubts kind of going through it. Like, do I deserve to be here? Am I like as smart as all these people? Like, I feel like I'm kind of struggling with some of this material, but I think when like talking through others in the program, I feel like you all kind of feel like the same way. You know what I mean? Like you're all in it together. You deserve to be here. Like everyone is struggling in their own ways. And yeah, I kind of went from there, and it's been great ever since. But like just kind of getting through first year was a bit of a struggle, I guess.
Yeah, I would agree. Like, honestly, you hit the same points that I think I struggled with in my first years. The sheer volume of it, it's like, it's impossible. It's literally impossible to keep up with it all. And I think you go from this mindset in undergrad where like, you're like, okay, I need to know every little detail of every little thing so I can get a 95 in this class so I can get into physio school. And then you get into physio school and you're like, okay, I'm going to learn every little it's impossible. You can't.
No.
Like, it's just, and once like you kind of accept that, it makes it a little bit easier. But I mean, the same things you're saying, like the doubt, like you feel like you don't really know. You're like, am I smart enough to be here? Those things all went through my head too, man.
Who knew managing volume wasn't just about the weight room?
Exactly. Oh man.
So like having gone through that, then do you have some advice for a newcomer, someone who's going to be starting physio school next week? How can they navigate some of those challenges?
Mm-hmm. Well, I think finding like groups, like study groups to work with, was pretty helpful. I think being able to apply like the physical skills that you're doing with somebody is important. Like you can't just do it in lab. You need to spend more time in that situation. But I think, like you said, like learning the basics really well, I think that's the most important part. Like you don't need to know every single detail, and they're not going to test you on every single detail in the exams. But like learn the basics well, and I would say like breathe. Like spend an hour, like go to the gym, lift some heavy shit, like go for a walk, that kind of thing. Like just breathe, and like it's gonna be okay. Like spend some time for yourself, and you're gonna be able to get through it. But like a lot of people I see like are head down in their work, like spend no time to themselves, and you just kind of get in this bad mindset. So that was my biggest thing. Like I spent an hour every day, went to the gym, kind of de-stress that way, and it kind of like it's a little bit easier to breathe and get through the program. I find that way.
Yeah, and it sounds like cliche, right? And it sounds like, oh, like just take some time, relax, breathe. But honestly, that it's probably the best thing you can do, because it's easy to get caught up in and putting your head down and really grinding, which is good. Like you need to do that, but also at the same time you realize like it's not sustainable. Like you can't, like you're in this for, so it's only 2 years, but it's 2 years basically straight, and you're going and going and going. And and you're going to burn out. So I would agree with that point for sure.
And then physio is like a large part of what we do as physio is collaborate with our clients, right? So a lot of those skills that you develop working with your classmates and managing that kind of stress is going to directly apply to your actual clinical skills. Where
That's right.
Just because you know everything doesn't mean that's necessarily going to translate to,
That's right.
that clinical environment.
And like we're preaching like health and fitness and like all this kind of things. So I feel like you kind of got to do it for yourself as well. Like you got to live it as well. You know what I mean? No,
for sure, man. With regards to like the classes, like obviously going in, you're expecting anatomy, you're expecting some physiology, some classes on neuro. Was there any classes that kind of you didn't expect to learn or take while you're in physio school that you're kind of like, oh wow, that's interesting that we're learning that?
So we did a course on spine, so it's just the spine basically, and I thought it was going to be about like manual therapy and like all this kind of stuff, but our prof was awesome and brought like all the latest evidence-based practice stuff, and we talked a lot about pain science and the biopsychosocial model and how that applies to like chronic back pain and that sort of thing, which I was stoked about. So like he referenced all of his slides with the latest research. We got time actually in the lab to be able to practice communicating and explaining these pain concepts and like analogies to each other, because I think lab's awesome for like the hands-on skills, like being able to apply certain exercises and that sort of thing, but also it's super valuable to be able to explain these concepts when you're trying to do it with a patient later on. Like you need to have some sort of experience with being able to talk and explain like what pain is, how they're feeling it, and like how they can de-stress in their everyday life and all those kind of things. You know what I mean? Mm-hmm. So that was super interesting, and I didn't expect that we're going to learn that at all, and it's been very valuable, I find.
Yeah, that's awesome. Like we actually have a pain elective at Western, where in our second year we can take elective classes, and unfortunately only 20 students get in. Like me and Will were lucky enough to get into the class and take it, and it was awesome. But I really like that idea of what you guys are doing in terms of getting into the lab and actually practicing those analogies and actually trying to explain it to each other, like as if you were trying to educate, because that's something like still I struggle with a lot. Like I just got done at a placement, and you try to sit there and explain it to the person, and you feel like, oh yeah, this sounds good, and then they're looking at you like, bro, what are you talking about? Like, so that's cool that you guys got the opportunity to practice that. Did your classmates like respond to that pretty well? Like, what was the consensus on doing that?
I thought, we wanted to nominate our prof in our program, like to get an award basically, because like he was just, I think everybody bought into what he was talking about. Like he's bringing a lot of research. It's not from like a 1980s textbook from way back when. Like, everybody bought into the concept and like responded pretty positively to it. So I think that's great when you have a class of like 74 or whatever buying into pain science when it's so valuable, right?
No, it is something though, like I do find it tough for some people to really start applying it just because it's not something that you know about.
Yeah.
Like you said, like you took a psychology undergrad. Did you talk about pain once?
No, probably not.
Like it's, and every time, if I mention pain science to just anybody, like a family member, they don't even know that's a thing,
No. And then they a lot of them think it's like, oh, you're telling me it's all in my head type thing. So you're like, you've got to really validate what they're feeling. Like the pain that you're feeling is real, but like also trying to bring these concepts in. It's a tough balancing act. And I think it only gets easier with experience and being able to talk about it. And labs help for that for sure.
So like, I guess my next question would be like, how did you feel what you were learning in school, like in class, translated into placement? How many placements did you go on in your first year? One or?
We went on 2.
Oh, nice. Okay.
Okay.
So, all right, sweet. So how did you find, like, how did it kind of work? Like, did you guys, for us, we had all of our coursework in first year and then all the way up until like June. And then we went on placement and then that was the end of first year. So we spent a lot of time in class. So like, how did it kind of work for you guys? Did you break it up?
We got thrown into placement right after first semester.
Nice.
So yeah. So we had one like semester from September to December of just academic, like your basic courses. And then like they toss you right into placement, which is terrifying. But I feel like it was awesome. Like you got to apply what you just learned in that semester. And you got to get experience in the clinic right from the beginning to kind of see where you need to improve or see where you're doing really well and that sort of thing. But yeah, like, I don't know, you're like CIs had 5 to 20 years of like experience and you've had like 4 months. So it's like, it's intimidating for sure. But you just learn so many great concepts and just like for me, it was private practice. So I got to like learn how the fast paced environment worked right from the beginning. And yeah. Yeah, go ahead.
No, I was just going to say how did you find like what you learned in that first semester of school? Did it translating over into placement? Like, what did you find helped a lot? What did you find maybe didn't help or wish you would have maybe known a little bit more going in?
Well, I think like learning all, I would say like just being able to learn like the foundations of physio, like all our special tests that we learn, like we learned manual techniques and stuff, which wasn't the greatest, but like all that stuff applied very well, but we didn't get to learn any of our pain sign stuff. And a lot of my patients that I saw had chronic back pain. So that was tough to like progress them through the treatment sessions together, like how to talk them through that. Or a lot, like you can look on their charts and some have like depression, other things, but like we never end up like talking about like any of those kind of concepts and what's going on in their life. And that's definitely a big factor in what they're feeling and their pain. So that was definitely tough to like kind of jump into placement with, but like, I don't know if I really felt ready, obviously going in from a semester of school, like you don't really feel ready for placement and what you've learned. But I think just with experience, you get more confidence and are be able to kind of talk to patients easier and like kind of know what you're doing. Like you're not thinking of, oh, did I hit every single red flag on my initial assessment? Like, did I do all the right special tests? Or like, did I do every joint, like passive and active range of motion? Like it's tough to kind of apply it all into like one setting. So I think just with time, it just gets easier.
So do you have any things that like just helpful, simple tips that have helped you with that sort of thing? Like organizing, how you're going to run through your special tests or what you're going to try to get out of your first initial assessment. I know that's something that like all of us as students and probably new grads struggle with, is just like, how do we make that initial assessment a little more simple? Is there anything that you've kind of gained from your first couple placements?
I think, well, being able to like, if you know your client list beforehand, you can kind of study up on like what they're feeling, like what condition they have and that sort of thing. That definitely gives you kind of a good base of knowledge going into the next day. So that definitely helped me for private practice. But I think we also kind of we make everything a lot more complex than what it should be in physio world, like learning a lot from like Greg Lehman and Adam Meekins and all those guys. Their approach is so simple. Like it's kind of building that therapeutic alliance with them, right? Like building that buy-in, talking about their like pain with them, right? And like symptom modification, and then like loading whatever they're having trouble with. Like that's the kind of the basics, and that's what we need to kind of focus on. But we kind of, I think going in first year, we just try to bring in way too many things and it gets too confusing and we don't really know where to go with it.
Yeah, for sure, man. Honestly, I felt the same way. And I think the one big thing I would say for me that really helped me a lot was just being like I don't have to know everything, or I don't have to get to everything on this initial assessment. And I think based off the way school preps you, and it is the way it is because you need to learn it all, but you feel like just the way that you've been educated that you need to get everything nailed down and done on the very first day because you need to pass the OSCE station.
Yeah.
So right? Like that's what you feel like. And then you go into clinic in practice and you feel the same way. And once, I realized that, all right, this person's going to come back most likely, do what you just said, like the subjective became so key for me because I realized the more I could just connect with this person and really hear their story, helped me form a little bit of a relationship with them where they trusted me. And then going into the objective portion, I tried to go through like what I thought was effective. And like even being in clinic, you want to practice some of the things that you're going to be tested on, like for the clinical exam to get your license. But if once you just kind of relax a little bit and not put so much pressure on, I guess, the objective portion and really finding out like what's the problem, that helped me like significantly in terms of just being more comfortable.
No, completely agree. Yeah. Like your initial assessment should be just like listening to their story, right? Like that should be like the main thing in building that relationship with them. You don't have to go through every physical test possible. And I think going into first year, you definitely feel like you do. So yeah, I definitely agree with what you're saying for sure.
Good. Yeah, I was just gonna say like the cool thing is too with reading about Greg Lehman and stuff like that I think Dalton and I have realized is you can get into the nuances of the special tests. So like say you have like 3 or 4 you're gonna do, you can actually use that as an opportunity to continue to set expectations. Meaning like if I'm doing a valgus stress test, I can be telling them like, wow, it's not your MCL. Your MCL seems very strong, which is good. That means we can do certain exercises.
Yeah.
And you're like building those expectations, like just from doing one simple test, right?
Yeah.
Rather than just kind of like sweating, so focused on getting it just like perfect, your eyes twitching, like.
Yeah. Right. And the thing is like that stuff's going to happen. Like that happened to us. It still happens to me. I still do it all the time. But once you like try to take those things into consideration, it just makes it a lot smoother, or it makes you feel better about what you're doing. And eventually you'll feel a little more confident.
Exactly. Yeah.
Did you do anywhere else? Did you do placement like in any other setting?
Yeah, my last placement, which was just this past June, July, was in an acute care setting in a hospital. So very different setting. I felt like a lot more comfortable going in there. Like I just feel like having kind of months of experience and like taking different courses, like I just have a bit more confidence. And that's what I kind of tried to bring into it. Like even if you don't really know what you're doing, but you sound confident and you have like a presence with when you're talking to the patient's going to feel more comfortable, right? And like buy into whatever you're trying to say. Whereas if you're kind of like, oh, you're talking very soft and this kind of like, they're not gonna feel confident what you're doing, right?
Yeah.
But that was interesting. Yeah, I got to see like a lot of like stroke patients and just like you're trying to get them up walking or get them out of bed, basically. Like it's a bit more simplistic an approach in comparison to like getting like some complex sports related exercises. Like you gotta, in that sense, it's a little easier, but it's still like a tough transition. Like you got to apply like what you learn in neuro and cardio rest and all that kind of stuff. So it was fun. It was good though.
Cool. That was in Kingston at the hospital there, or?
I was up in Perth, Ontario. So I drove hour and a half there, hour and a half back every single day for 6 weeks.
Oh man, good for you.
Dedication.
It was tough. That was like the farthest I would go without like getting in place for 6 weeks.
Yeah.
But it was tough. Like you wait, like you start at 8:30, whatever. So you got to get to like 5 or 8. I guess we start at 8. Got to get to like 5:30. Oh. You don't get home till like 5:30 p.m. basically. Like
yeah.
It was tough, but it was good.
Yeah, the grind don't stop, right? As the kids would say. So throughout your first year, you do a lot of OSCEs. You go through placement. You got any funny stories that come to mind? If it's not you, maybe a classmate that you want to share, and we won't tell them You don't have to name any names or anything like that, but
For myself, we did like a practice like OSCE station. So we brought in actually like people from the community that had like COPD, and got to do our full like assessment with them and talk to them, and like it went pretty well. And at the very end, I was like, "Oh, thank you for your time," that sort of thing. I was like, "Can I help you with your backpack while you're out?" And he's like, "No, that's my oxygen. It's connected to my nose, so you probably don't really want to take that from me."
Oh man,
very embarrassing, but we had a good laugh over it.
It happens.
I think that's important, like, though, for people to realize, right? Like, you're gonna have some weird, awkward moments or things where you just feel like you totally screwed up, but
oh yeah,
everybody goes through it. You know,
you'll go. I remember one time on one of our OSCE, it was probably one of our first year, like probably our first OSCE. Yeah, it was definitely our first OSCE, and we had to do like a Shadok assessment for like stroke. And they gave us the sheet, right? So like you could like kind of go off the sheet, and like I hadn't memorized it all or whatever, because like who has time to do that? So I'm reading the sheet, and then I drop it in the station, and it slides underneath like the divider. So like it's gone, and I'm just like sitting there. I'm like, all right, like what do I do now? So I go to like start to do it, and then whoever was in the station like next to me must have like pushed it back underneath, and it came back, and I'm like, thank God.
Oh man, that's hilarious, man.
We also wanted to, I think it would be hilarious to have like a camera set up and get the audio of every person that goes into the OSCE stations and just make like a video of it. Oh, it would be so, some of the things that I probably said, man, oh my God.
I know.
We had to do that. We had to do that in some of our courses. There actually is a camera set up in like our stations, and they made us go back and watch our stations to like try to improve on it, and it was the most like cringe-worthy experience of my life.
That's hilarious.
That's brutal.
Oh man, I wouldn't want to do that.
No way. No, I remember I like didn't even say anything during a station one time. Like walked into the station, and like I think I did like one exercise, and then I just sat there for the next 4 minutes. So like for anyone out there, like it's all right.
Yeah, you got it. We made it.
Yeah.
All right, man. So we got to talk about coffee. So we know you're a coffee fan. So why don't you? This is our favorite segment. So why don't you give us a little background on how you like to brew your coffee?
I like to brew it. I use a pour over V60, whatever you want to call it, drip coffee.
Yeah.
So. Only takes like a few, like we have two different ones that we have in here. We've got like a big glass one that we use for like a big pot of coffee, and then we got like a smaller one for individual cups, and then we just do a little pour over. Only takes a couple of minutes, but like I feel like you get the best tasting coffee out of it.
Yeah, man. Like I saw you sent us a picture of the individual like pour over one. Yeah. I've been wanting to get one of those for a while. Like I feel like that would be such a good cup of coffee.
Oh yeah, it's a game changer in the coffee world, that's for sure.
Yeah. Have you tried the AeroPress before?
I have tried the AeroPress. I think I tried at like some coffee place back home, and it's really good too.
Yeah. Yeah, that's our go-to. And the Chemex, like a Chemex pour over, like if you're making a big batch of coffee, but
yeah, it's good for like making like 3 or 4 cups. You don't have to keep with the AeroPress. You got to keep making individual cups.
Yeah, you have a problem when it's like the 4th time you go to like plunge the AeroPress, and you're just like, all right, we got a problem here.
Yeah.
So Alex, you're obviously into strength and conditioning and CrossFit. So have you found having this kind of experience and just learning from that setting has helped translate over to physiotherapy?
Yeah, for sure. I feel like kind of learning all the foundational movements, like your squat, your press, your deadlift, and all that sort of thing. It's so valuable in the PT setting, and we don't get really any experience in that in PT school. Like like for Queens, we didn't really have like an exercise class, right? Like we learned about like TheraBand, 3x10 external rotations. Like it's not the most functional movement out there, especially for different populations. So I feel like that definitely helped me in placement. being able to kind of progress and regress the patients through different movements.
Yeah.
And even being able, like, in the CrossFit community, like, the coaches have to be able to cue patients in like a few minutes. So having like, whereas in a PT setting, you have to like, you get 30 minutes to like an hour with a patient, right? So being able to cue somebody very fast and be able to get in a better position is super helpful in practice.
Yeah.
I think like one of the biggest things you said that we've really noticed is having that understanding of how you can modify, like how you can regress, like say a deadlift, if you don't have any background or if you haven't learned much, it's hard to know like, okay, well, maybe this person can't deadlift from the ground, but there's several other options that I can use to try to like modify this exercise. And I feel like if you're more confident with that, then you can start actually sprinkling in the other stuff, right? The pain science, the like knowledge of like how to make people feel more confident. It's hard to do that if you're so stressed about just knowing which exercise to use.
Yeah. I think a big part too, man, honestly, the biggest thing why I think we should probably learn these principles is just not being fearful of them, of like yourself, like as a practitioner. I think that's huge because like some of the things that I've heard, like just going around, like from whoever's just like, there's a lot of like, since they don't know about it, it's like there's fear around the movement of deadlift, or there's fear around the movement of overhead press, like a shoulder press, like someone coming into you who does those things and you being fearful or not understanding like of those, I feel like is one of the biggest problems. So just having just that base knowledge, like whether you don't even have to go and take a CrossFit level 1 course or like your CSCS, but just like basic understanding of like a squat, a deadlift, a press, to know like if you're going overhead, it doesn't mean it's bad and you're impinging your shoulder every time you go overhead, right? But unfortunately, I feel like sometimes that's the biggest barrier that I've seen.
Yeah, we have to be confident in our movement, like you were talking about before, like just with your voice, right? It's the same sort of idea.
That's right, yeah. Yeah, and it makes them feel like empowered and like robust and resilient, like being able to like seeing like a 70-year-old person like deadlift or like press, like that's, I feel like in the CrossFit world, they have like a saying where your needs and the Olympic athletes' needs, they differ by degree, not kind. So like we all need to learn how to pick up somebody from the ground. We all need to learn how to like squat to get to like a toilet or like be able to get up from the ground, right? So like sure, like the Olympic athletes might be able to throw like a lot more weight, but like having that foundational knowledge of those basic movements, I feel like is so important.
Yeah, man.
It's funny too, like you give someone like a 65-year-old lady a kettlebell and you have them do a goblet squat. It's amazing how good they feel, right?
Oh yeah. Using their joints through full range of motion, like yeah,
and then they're like, yo, I can go home and I can pick up that laundry basket, no problem. Like, let's go. And it gets me hyped up.
10-minute AMRAP laundry.
Laundry for time.
Yeah, that's right.
So you took Jacob Harden's Prehab 101 course, which is one of the courses that me and Will are really interested in taking. Like we've had Jacob on the podcast before, and he's awesome. Like we really, really love what he does and what he stands for. So how was the course? Just for our own personal knowledge, we're interested in hearing about it.
The course was fantastic. So it was taught by Dr. Jacob Harden and Teddy Wilsley, which is the strength coach therapy on Instagram.
Nice.
They're both incredible with the amount of knowledge that they know and just being able to like communicate in a simplistic approach to both like you and being able to like talk to patients, right? And a simplistic approach is so valuable. So it was an awesome course. Like he talks about his entire like assessment approach, how he goes about it. He talks about like stress thresholds and like the biopsychosocial stuff, which is great. And then he gives you like a full booklet of like movement maps for core, upper body, and lower body, and how to progress and regress all these different exercises, and like what standards to look for, and kind of like the points of performance and how to perform them. So it was awesome. And like the main thing is the main takeaway that he had was like, there's no optimal movement. Like everybody's different. Everybody's different imbalances. Everybody's like hips are like different. Like we don't often need to squat the same way and all these kind of things. And that's okay. Like there's no one size fit all, right?
Yeah.
I was actually talking to him about it like not too long ago, and he has some interesting thoughts, because it's good to have that base knowledge, right? Like you said, like how does like a sumo deadlift differ from conventional? But sometimes like it doesn't work out for that specific person. Like if someone's learning a sumo deadlift for the first time, it might be that they actually have more pain, even though they're not bending over as much, because they're worried about doing the movement and it's uncomfortable and not normal to that person. And I know Dr. Jacob Harden was talking to me, and he's had those kinds of things happen. So I think that's where you're like, it's not about the movement specifically. It's like how it's applied to that individual person.
Exactly.
Yeah. No, that's huge, man.
Yeah.
In the end, like he just says like education's our most powerful tool.
Yeah.
And I think he's like right on about that point.
Yeah.
He talks about recovery and fatigue management. Like it's just like it's a great comprehensive course. So definitely recommend it for sure.
Sweet. And you're taking Greg's course. I saw you post on your Instagram the other day. Pumped for you, man. You're going to love it. Great course. Me and Will took it, I don't know, was it November? I don't know, some point, and changed our perspective on a lot of things in a good way. So I'm excited to hear your thoughts on it.
I'm really looking forward to it. Yeah.
So let's talk about social media a little bit. Have you found social media useful for learning and kind of like being introduced to new information?
Yeah, 100%. Yeah. So like, I'm like, I don't know, I'm kind of, I guess, known for following all these different guys, and just like at Queens in our class, like I follow like all like the game changers, I call them, on in the physio world. And I think like it's like they provide all like their evidence like in social media. Like they've got great resources for you, like websites, blogs, podcasts. And I've learned so much to be like everything that they've been posting. And I think it's a pretty valuable tool, especially when you don't have an exercise course kind of in the physio world, right? Like for instance, even just like networking with them and like asking questions about certain things and what their thoughts are on certain things, like you get to build relationships with them, and like you learn so much from them, right?
Yeah, and people are pretty open. Not pretty, they are open to answering and talking to you. That's like the one thing we started realizing when we first started doing everything, is like people are really open to helping you. Like they're putting this content out for free. Like they're doing it because they want to help, not because like they're trying to gain a ton of followers. And if someone is trying to do that, you can sniff that out right away, right?
Yeah.
So I think one of the huge things, and me and Will have talked about this before on one of our other podcasts, but I think it does a great job of challenging somewhat of your critical thinking skills, because you have to take what you see on the platforms with a grain of salt, right? Like you're saying, people are providing resources, but people are going to have their biases. There is going to be information that's put out there that isn't necessarily right, or it might be skewed in a way to like support what they're saying. So I found for me, it was like I would see information and I'd be like, okay, that's cool. I like that. I would go and look into it more and look at research, or I'd look at a podcast, or I'd see what the consensus on that topic was. And it would make me be like, okay, is that something that I align with, or that makes sense? Or is this something that maybe it needs more research, or maybe it's not exactly like legit or applicable? So I think it really challenges your thinking in that way too.
Definitely, yeah. I mean, that's kind of what our job is, right? To really like critically think about different approaches. And I think that, sorry about that, kind of apply those different approaches, and is super helpful. Like you shouldn't just be taking whatever you see on social media like as the answer. I think being able to apply, kind of see what other research is out there and kind of form your own opinion is super important.
What's the general consensus in the classroom? Like, are your classmates doing the same thing as you, or are they maybe a little bit more hesitant?
We actually had like a debate class where we got to debate different concepts, and one of them was social media. So that was kind of interesting to see kind of you either had to be pro or con. So like you had no option, I guess.
Yeah.
Um, it was good to see like both opinions, but I think for the most part, I feel like everybody's so involved in social media these days that most people are pro. But again, like you said, like you can't just take whatever they're saying as the correct answer. Like you got to form your own opinion, critically think on it, and kind of balancing both approaches is more or less the consensus, I think.
Yeah. Cool. I think it's funny because I think you do that right now anyway. Like that's what you're supposed to do, right? Like it's just that social media is a platform where information can be distributed. So it's just a different way of receiving the information. Like before social media, you had to read or research articles and things and form your opinions and think critically in the same way. It's just now in a different way. And the thing that makes it a little more challenging is because it's an open and free platform. So many more people can have access to it. But again, you could look at that as a negative, but you could also look at that as a positive because now the freedom to explore and look for information is way more open to everyone as before. Like you had to have access to these journals. The people that were publishing in these journals had all the control. Like, you know what I mean? There's a lot of pros to it if you look at it from that perspective. At least, I mean, that's my opinion, but
yeah.
Well, and the cool thing is like you can reach out to us and you can be like if you're looking at a post and you want to know more about it or you want to talk about it, you can have a conversation with us about it. You can't really do that necessarily with every other platform.
It's true.
That's right. Have you guys heard about like Clinical Athlete?
Yeah, man. Yeah.
We just
I just joined this.
Yeah,
I just joined the forum like a couple of weeks ago, and like that is a great platform to like talk about different concepts and discuss with their PTs about research, see what they're posting about different exercises. They've got like great like webinars from professionals out there on certain topics. So I found that a great resource to kind of not only connect with people that have like kind of similar like strength and conditioning principles or whatever you want to call it, but also be able to just discuss topics with them and network, and like there's like placement and work opportunities on there. Like it's pretty awesome.
Yeah, for sure, man. I highly recommend that to every student that's interested. Even if you're not even interested in like the strength and conditioning world, like there's so many resources on there, man, to learn from. The webinars are awesome too, for sure.
Yeah.
Let's kind of wrap it up here. So you're heading into second year. So you're there, final stretch, man. You got one year left. What are you most looking forward to, and maybe what are you most worried about or concerned with going into your final year?
Well, I'm stoked to be able to take some courses, like some outside courses, like you were saying, Greg Lehman's course, and also taking functional range conditioning course. And just being able to apply what I learned into clinic. I think like I'm stoked to learn like just go on placement and get some more experience. Like I've only had 2 placements and we've got 3 this year. So like just getting more confidence in the practical world, I'd say is what I'm looking forward to most. Concerned, I think a lot of us are kind of concerned, like in the next year, are we going to be like entry-level physiotherapists? Like, are we going to know everything kind of thing? Like,
no, you're not, just so you know.
I feel like everybody, like even 10 years in, you're still constantly learning, right? Like that's always a worry though. And of course the good old national exam at the end is going to be a good time.
Yeah, it's fun.
Do you guys just do the written national?
Yeah, we did the written in May, so we're good. We passed the written.
Awesome.
We got the practical in November, so
almost there. One more, and then you guys are physios, officially physios.
At least that's what the paper will say.
The written is nothing to be worried about either.
Yeah, I would. You obviously have to prepare for it and study just like everything else, but I mean, you seem to have the right mindset going into things. It's like you have to find the right balance, right? You gotta find the balance of studying the information, preparing for it, but at the same time, like getting so overly worked up and stressed out about it, it's not going to put you in a good mindset to do it. So your school prepares you I'm sure they prepared you well enough. Western prepared us well enough. So, you know, you got to get after it like anything else, but you guys will be fine.
Awesome. That's good to hear.
Yeah. I mean, if we made it through, man.
We're here, then
yeah, you're good.
Then you'll be all right.
So
you're good to go. All right.
So for the final question, man, if you could offer one piece of advice to a first-year PT student that's gearing up 1 week from now, they're about to walk into Queens, Western, wherever they're at across the country, what piece of advice would you offer them?
Mine would be like, take it upon yourself to just learn and connect outside of school. So like follow some people on social media, whatever it might be, send them a message, connect, network as much as you can. I think like for me, it's allowed me to kind of find my direction in the PT world, like what I want to learn about, what I like, how I want to build like my practice later on in the future. Like it's given me some direction, and it's just allowed me to like learn so much more.
Perfect, man. That's spot on. So I mean, is there anywhere you want to leave your Instagram or whatever so people can find you?
Sure, yeah. Basically, it's my own personal Instagram. Like I haven't made it a PT Instagram yet. Always down for questions, and like if they have any questions about like how to get into PT school, how to like what advice you have, I'm always down for that. So it's at Alex Derksen 12. Also have buddy that's created a YouTube channel called it's a Canadian physio student. So he's kind of coming up with a YouTube channel on like what to expect in PT school, and like any advice, any skills, what is like a day in a life of a PT student, which is gonna be sweet. So
cool, man. Yeah.
Sure, he'll have some content about that too.
Right on.
Yeah, we'll link that up in the show notes and stuff. I'll have to check it out. That's cool.
Yeah.
All right, man. Thanks. We appreciate you coming on. It was awesome. It's great to get a student's perspective. That's something that we want to start doing a little bit more with the podcast, is start talking to more students, start talking to some new grads, kind of try to bring all the information together for people to take in. So we appreciate you coming on and sharing the information with us. You're doing awesome things, man. By the sounds of it, you're heading in the right track of, you know, taking control of your own learning. You're finding your way. That's awesome, and it fires us up to see other students doing that, because that really changed the game for us. So good on you, man.
Thanks, man. Yeah, I really appreciate the opportunity. You guys are killing it out there. So keep on doing what you're doing. You're definitely gonna do some great things with all the platforms that you've created and are sharing with everybody.
All right, man.
Appreciate
it. Will, you got anything else?
Nope. Appreciate you coming on and chatting with us.
All right, guys. We'll see you next time. Peace.